Hello, everyone. Oh my gosh, I'm so excited. There's actually people here. I was like, oh my God, what if nobody shows up? I'm like, no, it doesn't matter. I'll present to one person. I'm so excited that you all have joined today. I am thrilled to spend this afternoon with you all. And I see some of my lovely past students here, and I appreciate your support. If you don't know me, my name is Lily. I'm a neuro PT, and I'm also known as the brain PT. So that you'll hear the whole story about how did I start to bring this thing to life. So I'll tell you things that I've never told before. And also I hope you become inspired through my story, through my failures, through my successes. And I really hope you enjoy this little afternoon with me. I hope you have a drink with you, whether it's wine or coffee or tea. I have a mango tea right here that I got from my Amazon purchase in a pink mug, because we know pink is my favorite color. But anyways, let's get started. Again, I'm Lily. I'm a PT. I'm a neuro lover, neuro obsessed. I am an educator. I'm a mentor. I'm a dreamer. I'm a wife. I'm a mom to a beautiful daughter called Emma. And I am so curious. I just love to go on rabbit holes on any topic, not just neuro. Like literally, I'm like, okay, why does my sourdough starter does this? Like, I'm just curious. But welcome if you're here. And my journey began as a dreamer. I was born in El Paso, Texas, but I was raised in Mexico. So I live in a border town from Ciudad Juarez, Chihuahua, which is Mexico. And then we have El Paso. So I was raised in Mexico. So all my schooling was in Mexico. So kinder, elementary, everything was in Mexico until I came for college here. I, since the beginning, had this weird, like, not obsession, but like love for everything neurology. So in this picture that you see here on the right, there was an art exhibition at the El Paso History Museum. And for some reason, they had this brain, neurology exhibition. And I was like, oh my God, I have to go see it. So this picture that you see here, every like square that you are able to appreciate, it's actually like I don't know how you correctly pronounce it, but like pastel art or pastel coloring, black and white and gray, I guess. So it's all art. So I was just, obsessed with the brain. When I was little, I wanted to be a teacher, an astronaut, a cashier. Okay, a cashier. I wanted to be a marine biologist. I love like all the sea animals, the whales, etc. But then I was like, I kind of want to do something on the healthcare field, but I just didn't know what I wanted to do. So one day I was in my house in Juarez after watching Hannah Montana with my sister. Okay. I was like, what about, physical therapy? So I searched physical therapy on Wikipedia. So that's how I discovered the profession. I never had an injury. I hated sports. Okay. I was never like back then when I was in high school, I was never athletic. Okay. I was just like, let's just search, so that's how my journey started. Is just so weird. So, but how did this like passion start? So when I moved to El Paso, I did my undergrad at UTEP as well. I graduated with a kinesiology major. And when I was doing my undergrad, I just had this like weird, like, I love the brain. Like, I don't know why, I just feel it's so like interesting. So one day when we were crossing over back home from Juarez to El Paso, because there's a bridge that you have to cross, and they check all your documents, and it's like the customs, etc. So my dad told me, there's this movie that's called Gifted Hands, and it is really good. Like, you should see it, he told me. And I was like, okay, my dad is a fan of movies. Okay, he is obsessed with, he could spend the rest of his life watching movies. So he told me about this movie. So if you don't know this movie, this is about Ben Carson, and Ben Carson is a neurosurgeon. So he's the one who I think did the first surgery of separating some twins that were connected by the head. Okay, so he literally separated their two brains. Okay, so this is, of course, this is not the real Ben Carson, right? But the story is about Ben Carson. So the movie has a clip, and I believe this is on Netflix. I'm not sure, but I can find out for you. There's a clip on the movie that it says, like, the brain is just this miraculous thing. And he's like, oh my god, it's so I got excited when I was watching it. But after the movie, when it was done, I still remember the moment like it was yesterday. I felt like, oh my god, like, this is it. Like, I have to do something. And then I had a crisis. So it was an excitement, but then followed by a crisis of, I don't know anything. Like, I don't know anything. If I want to do something in neurology, I am so dumb. Like, I don't know anything. So that's how, like, okay, I know, like, this movie, like, is telling me something about my career, my destiny, I guess. So then after that, when I was living in Juarez, years before I moved to El Paso, I was a church leader in Juarez. Okay. And one of my closest friends from the church around my age back then, we're talking like 10 years ago. I don't even want to make the math, but a long time ago, he had a big stroke. Okay, so this was a stroke in a young person in his 20s. Okay, so after this happened, so it was, the movie, and then my friend's stroke, I just wouldn't understand why a person so young would have a massive stroke. So when we went all to pray for him at the hospital in Mexico, Juarez, etc. And that day, I made a promise to myself and to God that I would become a neurologic therapist. But back then, I didn't know if I really wanted to, after watching Ben Carson and thinking about the brain, I didn't know if that was exactly what I wanted to do. So I didn't take that promise I think I can, but I don't know if I want, etc., etc. So anyways, fast forward, my friend survived his massive stroke. And now, he is like a normal individual, able-bodied. So anyways, I graduated from my undergrad. I got into PT school, and this is 2015, okay? Thinking I am going to become a neuro PT, but I didn't know if it was a neuro PT or maybe I wanted PEDS, because PEDS is connected to neuro, but all it goes back to neuro. So I didn't know. I liked everything. Once you're in PT school, everything is interesting. Like orthopedics, there was a time that I went to be an orthopedic therapist. PT school, everything is so interesting. But once you go to your rotations, you start kind of chiming into where you want to practice, like the specialty that you want to practice. So my first rotation was in Austin at UMC Brackenridge. Well, it's no longer UMC Brackenridge. I don't know what it's called now, but it was the county hospital. And just weirdly, I started to get a ton of neuro patients on my caseload as a student. And I would really enjoy it. So in that first rotation, I started to get a reinforcement to that calling. And at the end of my rotation, I was at a coffee shop with a friend, and randomly I told him, I think I'm meant to be a stroke PT. And I just didn't think any of it. I just said, I think I'm meant to be a stroke PT. So my third location was in Timber Ridge in Arkansas. Timber Ridge Neuro Restorative Ranch is a place in the middle of the woods, no Wi-Fi, no nothing, but it's like a place that is surrounded by nature, which, it's supposed to be like a healing environment, right? I mean, it was, but it's like, oh my God, it's just, we are surrounded by trees. So all the green thing you see on the screen is trees. So we won't have signal. So it was this place focused on rehabilitation for people after traumatic brain injury. So when I got to Timber Ridge, I was nervous because I was like, okay, what if I don't like it? Like, what if I don't like neuro PT? And now I'm kind of screwed because now I don't know when I'm supposed to be. So it was challenging. So those of you who've worked with people with traumatic brain injuries, it's challenging, right? Because we deal now with the behavioral part of neuro and, all the unwanted sometimes behaviors, etc. So, but in the end, I got so much experience. And I remember before I started the rotation, I started just reading about TBI, started building a binder, which I actually have right here. This is for my rotation from Timber Ridge. I built a binder. This is an advice for you if you're a student. It's called the Mindy Matters in Physical Therapy. And literally, this is a binder that I created as a student for me to just guide myself on things TBI. So I have like cognitive stuff. I have all these things for just TBI. So then I was okay, I think I like this, right? It's like when you think you like something, but you're quite not sure yet, but you're maybe sure that you want to do something, right? So I graduate, and in my mind, I'm like, okay, I want to do neuro PT. Perhaps I want to do residency. I don't know. Once you graduate, you'll see a lot of your classmates, if you're a student right now joining me, that a lot of them have jobs lined up, right, from other rotations, etc. And guess what? I just still didn't know where I was headed. I didn't have a job lined up because I wanted to do neuro. And here in town in El Paso, we don't have neuro clinics per se. I didn't want to move because I'm very close to my family, so I didn't have a plan yet. Okay. So this is now 2018. Okay. When I graduated 2017, December. I took my boards 2018, February. So by this time, already with the license, I did not have a job. Okay. So this is to remind you that you don't have to have everything figured out. You just have to, sometimes you just have to be open for the destiny to start showing up in your life. So now it's around beginning of March, and that is when end of February, beginning of March is usually when the combined sections meeting takes place, which is the largest PT conference. So me and my boyfriend at that time, which is now my husband, we went to CSM in New Orleans. Okay, and we had the greatest time because it was the first time I convinced him finally to come with me to CSM. He's a PT too. So coming back home, I told my husband, that there was a job that I was thinking at the county hospital in El Paso. So it's UMC. And that someone told me that they were building the neuro ICU there. So, kind of thinking about that job, I told my husband that I kind of wanted to be there and have a job there. And I told him I want to be the therapist that is in charge of the neuro ICU. Like, I want to be that therapist. I didn't have the job yet, but I told him, if I get the job, I'm going to be the therapist in charge of the neuro ICU. So looking back, I later discovered that, again, you create your own destiny. And guess what happened? I became the PT in charge of the neuro ICU. So I started, I was a newbie at UMC. I was a new grad, very shy, very introverted. I'm an introvert. Okay. I could seem in social media, in my classes, like an extrovert, but I'm really an introvert. If I have to be in a room and just be quiet, I would be quiet. So I was that shy graduate. People probably will, the more experienced PTs would probably, laugh at me because I was just, telling them, hey, can I get some patients in the neuro ICU? They probably were like, who's this to ask us? But, I really wanted to just do neuro and follow what destiny was telling me to do, right? So then I started to build that experience in the neuro ICU. I treated everyone there, all my patients, with so much passion and curiosity and love for mobility, love for out of bed, love for let's just transfer you to the caddy chair, let's slide you, etc. if they're appropriate, right? The neurologist started to notice me and how I worked, how I really was not afraid of moving those patients, the stroke, post-stroke. And with the help of my techs, we even moved people post-stroke in a ventilator. So I was just, bold and confident. And even though I didn't know I was a new grad. Okay, the only experience I had in neuro was my rotations, which is, you don't have much experience in your rotations. Let's say if you never saw someone intubated post-stroke, right? It's just limited experience as a student, but the real experience really comes when you are out there and treating people as a therapist, and now you're independent, right? But I was a novice. I didn't know, like, back then, how to do a great neuro exam. So, but the thing is that I was curious. Okay, I wanted to learn, and looking back at my patients that I met at UMC, I met people that really played a big role in my just career as a therapist and why do I do what I do. So I want you to think and stop right now and just think about this, right? There are people along your journey, the journey that you are right now, that you are meant to meet because they will benefit from you, from your skills, from who you are, from your thoughts, from your, from who you are as a person, from your love for movement, for your love for the profession. They have been placed in your journey for that reason. Okay. One person, maybe two. I can count maybe 3 people in my journey from all those 7 years. Those people have marked my why I do what I do. Okay. And some of my students have learned from those experiences, and I've shown pictures, and, unfortunately I cannot share pictures publicly, right? But I want you to stop and start paying attention to who you meet in your journey, because they will play a role. And maybe you can already start thinking like, hey, this person was actually one for me, and just keep that in mind. So, all right, I've been working at UNC for 1 year back then, right? And I'm deciding, okay, I think I'm going to do residency. okay, well, I'm gonna apply. I'm gonna apply to all the residencies in Texas. And also, if I had someone who I knew that recommended me this residency in California. So, I'm gonna apply to this in Texas, this in Texas, this in Texas, and this in California. Okay, so I do my application through RFPTCAS. And again, if if you have questions about residency or anything that I've mentioned so far, please know that there will be a question and answer at the end. So you can please present any doubts or any, curiosity that you have. I'll be happy to answer. But this is the RFPTCAS. You apply, you create your essays, right? And I was so convinced now, yes, neuro residency, like this person made me so sure. I made sure my applications were on point. I would go to this coffee shop and just work on my applications all day and my essays after work. So I got my first call for my first interview in Houston. Okay, I was so excited. So I was like, I am ready. Like I'm going to be a resident. I'm going to be a resident. I created this Google Doc, giant Google Doc with like possible questions. I researched like what was a residency about so I can know how to answer those questions. Like I practiced so many times before the interview started. I listened to the Hall of Fame song by The Script like 1,000 times. And when I got there, in a room, like maybe it was 5 people, I started to experience a lot of imposter syndrome. So what am I doing here? Like again, that shy Lily, like nobody talked to me, like I'm not worth it, like I don't know what I'm doing here, just started to kick in. And I'm sure you experienced this. What am I doing here as a PT student? Like they're gonna discover I'm a real fraud and I don't deserve to be here. And it was like, what? I was not confident, right? But I just like, okay, let's just finish up this interview. Looking back, my interview was like, oh my God, why did I say that? Why did I say what I said? A couple of things, right? And but I was like, okay, I'm a good student. I was a good student. I'm a good PT, and I'm gonna get this. So guess what? I was rejected. And I was not rejected once, but I was rejected twice to 2 residencies. So I still had some interviews left. So can you imagine how I felt? That rejection of probably this is not for me. Like probably this is not my destiny. And maybe I should just, give up. So I had another interview in Texas as well. I traveled. The program was just it didn't feel like, it was something that I was like very convinced, but I don't know if it was just the rejection feeling, the feeling of I'm not worthy. I'm not probably meant to be here. Right. So that just, that. So then I had my final interview. And this was one that I was just feeling so defeated. Like I was like, my confidence was on the floor by then. And this was my last interview at Kaiser Permanente. And this was a virtual interview. So I gather myself, right? I didn't know if I had been accepted to the last residency. I didn't know. So I still had that rejection feeling, right? And I just gathered myself and I was like, I'm not even gonna practice. I'm done. Like I'm just done. So, all right. So my interview comes, and it was probably 10 minutes before my interview with Kaiser started. And my lovely computer decides that, it wanted to break down. So I took my interview. Imagine the stress. Okay, 10 minutes. Like, oh my, no quiere prender. It's where's the battery? No, my God, not the battery. What is going on, right? And then it was not on Zoom. It was like on this weird platform. So I'm like on my phone, like, God, we're like, I'm not meant to be a neurotherapist. So I take my interview on my phone, okay, with Kaiser. So imagine the interview starts. I have this like, oh my God, like this adrenaline anxiety, okay, when I start the interview. So I already knew, it's like when you start a presentation or like a practical or, whatever, and you start like not in a great calm place. So you feel like your mind is like, I don't know what I'm doing. So my interview was terrible. Okay. They asked me like, can you tell us how would you do a neuro exam? And I said everything of how to do a PT eval except the neuro exam. Okay. They asked me all these questions that I was terrible. I started and I finished the interview like it was not a great interview. Okay. I was just down. I was sad. I was defeated. I just show up just as best as I could. And I think what made the difference was that at the end, I sent a thank you email saying that, recognizing and being vulnerable, like I was very nervous through this interview, and because of that, I was not allowed to let my light shine through this interview. And, thank you for the opportunity to get to know me. And I think that looking back, I think that made a little bit of a difference. Or maybe, I didn't do as bad as I thought because I got in to the Kaiser residency. I don't know why, but I got in. So this is a reminder that you will be and you are where you're meant to be. Even if everything feels like it's a disaster, even if it feels like you're a mess, if that is meant to be for you, nothing will let it not be for you. It's just you are where you're supposed to be. And if you're rejected to residency, if you're rejected to a job, if you're rejected anything, just remember that perhaps that opportunity is not as good as you are for that opportunity. Maybe you are too good for that opportunity. Okay. And remember that maybe that's not supposed to be part of your journey. So just keep going because you will end up where you're supposed to be. So, okay, I was in. Woo, okay, I packed my bags, 2 big size bags that, looking back, I don't know how I got them out of the thing at the airport that keeps going, and you're like, your cerebellum starts freaking out because you're like, oh my God, what if I can't pick it up and it's gonna be too heavy and I'm gonna fall over? Anyway, so that's my my thoughts every time I pick up my, the baggage claim. It's like my cerebellum starts freaking out because what if I can't adapt to the load? Anyway, so I moved to Northern California, Redwood City, to start my residency. This was Kaiser residency, 2019 and 2020. So, yes, I was in residency in the middle of COVID. When COVID started, I was in neuro residency. And I still remember like weeks before COVID actually started to be like, okay, I think this is real. I told a friend, I think this is, people are exaggerating, etc. But I was there as a one of the COVID residents. But the residency taught me a lot, despite needing to transfer from one-on-one patient care, which was all my acute when COVID didn't exist, or we didn't think it exists. And then I transitioned into telehealth, which means I did not touch a patient. I was not touching my neuro patients. So how am I gonna treat all these people as a resident? Am I even learning? So it was just, I was so sad that this happened, right? But looking back, the residency taught me a lot about mentorship and being so vulnerable and that growth mindset and having kindness and compassion. And not only compassion to your patients, compassion to yourself, right? It taught me about empathy. How can I connect to my patients' feelings and what they're going through right now? Can I put myself in their shoes with a situation that's similar to my patient's situation? And it taught me a lot about communication, meaning not only talking, but also being present with my patients. So in the midst of the pandemic, I was treating people with neuro conditions without even touching them, and they were getting better. So going back and thinking about why this was happening, I'm going to remind you today that yes, we learn all this test and interventions, fancy things, therabands, manual cues, et cetera, et cetera, et cetera. But the main thing is if you listen and if you're able to be present and if you're able to really pay attention to what your patients are telling you, that is a skill that is so important as any therapist. But since we're here and talking about brains, as a neuro PT, this is the greatest skill that you would want to develop. Okay. So I graduated from residency. This is August 2020. I moved back to El Paso. It was pandemic time. Moved back home time. So I started working at an inpatient rehab. In residency was 24/7 neuro. I loved it. It was my life. And I come back to El Paso with probably from 100% neuro, I was doing maybe 30% neuro. So it was, quite a shock to come back and not do neuro all the time. So I was here at home with a friend while I was starting to study for the exam for neuroclinical specialist. And my friend Michelle, she told me, why don't you create like an Instagram and you just post like neuro things? And I thought, yeah, if you don't know me too much, when I was younger, I used to record videos and post them on YouTube singing. So I'm introvert, but recording myself not too scary. So I used to record myself singing. I used to think that I was good. So I was like, maybe I could record myself not singing, but maybe just teaching. So don't look me up on YouTube. Okay. You're not going to find me. So anyways, so I started to create stuff on, softwares. Maybe I can create my logo. And, I started like brainstorming. So this was my first logo. Then this one, I was like, it's not there yet. And then the third one, I was like, okay, maybe this is the first post in 2020. So still, really after my graduation from residency. And, I was just like, okay, let me just see where this is going to take me. And then eventually this became this, which is what you're already familiar with when you see my page on Instagram. But I started to post stuff. This is 2020. Okay, this is 4 years ago. I began posting things like, I was like diagnosis Sundays or, outcome measure Mondays, things like that. And I just kept showing up because I was studying. So I was learning. So I was like, okay, let me just share what I'm teaching, what I'm learning. Right. But nobody was paying attention. Okay. I was making videos. No one watched. Okay. But I kept showing up because neuro was my passion. And because teaching others about it was filling that gap of that 30% neuro, the other, percent, 70% was like nothing, but no one was paying attention, right? So when I started going through this process, the Brain PT helped me discover my second passion, which is teaching. So this is when I joined UTEP, which is a University of Texas at El Paso, now as a faculty. And I didn't want to be like part of their core faculty. I just wanted to be like a helper, okay? Because I was not good, right? I was like, I'm not good to be faculty. Like, just bring me as a TA, or So for some reason they were like, okay, you're gonna be core faculty. I'm like, what does that mean? And they were just, well, you're part of kind of like the leader of the faculty. I'm like, me? Like, really? No. I don't know. I'm just, I'm no one. So they bring me in to help with Neuro Rehab 1, and then Neuro Rehab 2. And then they're like, okay, there you go. Now you're going to lead the course. So I'm like, I don't know if I'm just still imposter, right? That imposter always kicking in, making us believe that lie that we're not good enough. So then I was like, okay, well, I'm just gonna do my best, and I hope I don't mess anybody up with what I'm teaching. But again, I was teaching. My second passion, I was teaching, and then I was teaching neuro. So then they gave me the third course, which these 3 courses are the ones that I currently teach at UTEP. And in the meantime, the Brain PT kept growing because I just kept showing up. So there was always that voice inside of me, right, that told me, like, just stop. Like, nobody cares. Nobody cares what you're doing. Like, people think you're ridiculous. Like, just stop. But that tiny voice, like, very deep in me, there was one voice that kept whispering, keep going. Someone is going to care. Someone is paying attention. So between UTEP and the Brain PT, I developed that service-oriented mindset, which just kept me going and kept me stepping forward, sharing my message, my passion, what I love the most, and making just a significant impact, wanting to make a significant impact in the lives of my students and anyone who cared watching the YouTube, the Brain PT videos. So that's where we're at. And then again, just kept showing up, never stopping, because neuro is the passion, right? So I started growing the audience. People started using my videos to learn. People started using my videos to study for NCS. And then, the people that I look up to, if you're familiar with JJ Maurer-Tinney, Mike Studer, Julie Hirschberg, and if you're not, these are people that you look at them and you're like, oh my gosh, these are like celebrities. They started to know my name. They started to knowing who I am. And then people in town, we would go to places and they would tell me, are you the Brain PT? And, it was the moment that I was like, I just gotta keep going. Just gotta keep going, right? So here, this is a reminder that if you have a passion, you just gotta keep pushing, and you gotta find that voice inside of you that is telling you you're meant to do something great. So now the Brain PT is, I consider, and I want to think, is one of the go-tos social media pages that is going to offer more than 100 neuroeducational videos, including interviews with key figures and leaders in the neuro rehab world. And also you're going to find free resources. So now the Brain PT, who I think it's a separate person, even though we're the same, but I am so in love with the Brain PT because she's so bold and brave to put herself out there. she will offer online courses in neuro PT topics in the future, near future, including cerebellar ataxia. And if you're planning on taking the NCS, there will be something for you as well. So I didn't start here. I want to remind you, I didn't start here as an NCS, as a teacher, as the brain PT. I didn't start here. I started failing my neuro quizzes. Okay. Not knowing what an MCA stroke was, not knowing what, how to treat someone post-stroke. I did not start here. No expert began being an expert. I started with one follower. I started with one email wanting to volunteer at the Neuro Academy. I started with one email telling UTIP, I would like to teach. So it starts with one thing, okay? The expert was once a beginner. So, and sometimes despite all this experiences, I look back and I still think like I'm nowhere where I want to be. And I'm sure you've thought about, you need to be honest with yourself. You've thought I'm nowhere where I want to be, like nowhere. And sometimes we got to remember that there's something called the gap or the gain. Okay. And if you're always thinking I'm nowhere where I want to be, there's always going to be a gap, okay, between who you are now and who you want to be, always. Because even though, you do this, you become a specialist, you do that, you're always going to say, I'm nowhere where I want to be. Like, I'm nowhere where I want to be. But if you switch that thought and look back at everything that you've gone through and everything that you learned and everything that you've overcome, you would always see a gain. And when you deal with imposter syndrome, I want you to look at the gain. Okay? Look at me. I'm here in PT school. Sometimes I feel like I'm not meant to be here, but guess what? I've passed this semester. I've passed the semester. I'm now in rotations. I'm one step from graduation. This is a huge gain, right? So today I want to share that you need to take a moment right now to think how far you've come, how far you've made it. Because I want you to look right now. I'm in my rotation number 3, number 2. Look at that. It's so much gain, right? So I just want you to keep following your passion. If you completed your PT program, if you completed a residency, if you all of that, just look back. And if you still haven't found what you want to do yet, whether it's neuro, whether it's this or this, remember that you just need to let destiny show up for you, but pay attention to who you meet, okay? Pay attention to who you meet, patient, professor, mentor, family member, friend, whoever, because they play a key role in your journey, okay? But keep following that passion because it will lead you to your purpose, okay? If you have a passion, you can be great, okay? Because one day your effort will go noticed. One day you'll find your people. One day you'll find that voice and you will realize that it was always inside of you. So show up even when you feel insignificant. Show up even when you feel it sucks and you're rejected and you're not worthy, because you will see the extraordinary. You just gotta keep showing up, okay? So I want to open up the floor for Q&As. Oh, but before, I want to, because you're still here with me. I hope I didn't put you to sleep. But there is a bonus for you because I love prizes and I made this with so much love. There's a bonus for you because you're here, okay? And this one, nobody has it. You are the first ones who have this. This is my top 5 things or tools for aspiring neuro PTs. Okay, so these are my top 5 favorite things that I've used now. Now I go back to them. And I also used during my residency and when I was studying for NCS. So those top 5 things are for you. Okay, and then I also have a bonus thing here on the same guide. So you just scan the QR. If you have problems with the QR, please let me know, because this is a one-man show and the man is me. So sometimes technology is just tricky, but please let me know if you have trouble with the QR. So go ahead and do that. And on the chat, tell me if anybody has trouble. So you will sign up, and on your email, you have to confirm, and then you'll get the PDF. Okay, nobody has this. Nobody has this. Is this, you're the first timers with this. So go ahead and do that. But the last thing I want to show you before, and I'll go back to this screen. Okay, but the last thing I want to show you is in the fall. Well, okay, never mind. We're already in the fall. In the winter, because now, you know, we are in pumpkin spice season. In the sugar cookie season, and if you go to Starbucks, you might know what that is. It's just winter season. There will be a live workshop, okay, which is going to be all about ataxia, cerebellar ataxia. So this is creating a multidimensional physical therapy program for individuals with ataxia. So we're going to help the disorder of lack of order back to order. Now, why ataxia? Because that person that, one of the persons that I met in residency that I did not touch had cerebellar ataxia, and she was able to overcome the ataxia without me even touching her. So here I'm going to give you all the things that I incorporated in her program through telehealth, but just so you know what to do if you have someone with cerebellar ataxia. So here is the other QR code, and I can go back while everyone is, if someone has questions, etc. But these are the two QRs. One, if you want the guide, okay, and the other one is if you want to be in this workshop. This is the newsletter, so you can know, okay? If you're a student, it will be free. If you're a clinician, it will have a very, very low cost, okay? So I would like to open up the floor for questions. You can, oh, Trisha, hi, we're wide awake, so inspirational. Oh, thank you. I'm so glad you're here. Please type in your questions. How are you feeling? Tell me in the chat. Are you overwhelmed? Are you happy? Are you tired? I want to see some engagement in the chat and questions. Any questions that you have? Let's see. I want to see if anybody has their camera on. Let me see. Anybody? Elena. Hi, Elena. Okay, so she's asking. You're welcome. I'm so happy to share my path. What do you take into consideration when looking at different residencies? Okay, so this is a great question. One is, I will tell you maybe three things. One is in state, okay, just because it will be easier to apply to the ones in your state, okay. Not sure though if there is an out-of-state difference, but I would look in I would look for the ones in your state. Second, I will look at the faculty in the residencies. So a lot of people search, let's say, for they know a PT that, you know, maybe is expert in Parkinson's disease, and you know that she is teaching or she's mentor at this specific residency, then you may want to apply to that one, right? But it doesn't have to be, but some people research their faculty in the residency page. And you can also, in the residency page, you can see who the faculty is. And let's say they're more specialty is in vestibular, and you're actually looking for something like acute care, then that might be something that you might not want to apply to, because you want to be more acute care and they are more focused on vestibular, something like that. So I recommend looking for the faculty. And the third one is, let's say if you look for out of state, where is the residency? Like, is it in, like, for me, like California, it's really expensive. So you have to consider that price and the cost of living, because as a resident, you may be paid less than as a regular PT. So if, of course, residencies where the cost of living is high, the salary for residents is high as well, compared to, let's say, other places like, Dallas or Austin. In California, I was paid more because the cost of living, it was so expensive compared to someone, in Austin or things like that. So I would say the cost of living. And when you're applying and in the interview, you gotta ask for the salary. Okay, you gotta ask, because you don't want to go to residency where you're struggling financially for this whole year and you're stressed about finances, because you're living paycheck to paycheck. So that's you gotta ask for the salary when you're applying to residencies. So number one, apply to in your state, see what they offer. Two, if you want to research the faculty, okay, see what their experience is. Usually most residencies, they have pretty diverse faculty with the diverse specialties. Like, when I say diverse is, someone is specialist in Parkinson's, someone is in acute stroke, someone is in, complex movement disorders. So, things like that. And the third is the cost. Look at the place, if you want to apply, let's say in Florida, okay, what's the cost of living there? And it's going to be a jump if you're in Texas to Florida, so consider that as well. I hope that helps you. Okay, so let me know, Elena, if you have more questions about that, or if you want to follow up. So Tyler asks, what would be your advice to someone who has just started PT school but has an interest in neuro? How does one get started in just learning? Okay, go back to those top tools for aspiring neuro PTs. Now, these tools that I'm offering you are not like, if I have these tools, I need to do neuro. No, these are tools that are, favorite resources, favorite books, favorite podcasts. So this is your place to start. But if you have an interest in neuro and you just started PT school, I would recommend to start digging into the neuropt.org, which is also included in the toolbox here. They have podcasts. I love podcasts. So learning on the go is something that's essential for me. Right now, my favorite podcasts are like in online marketing, completely different than neuro, but so podcasts is a great way to start. They have podcasts in the spinal cord injuries special interest group. They have podcasts, really good podcasts in the degenerative diseases. So, they talk about Parkinson's, MS, ALS, all of those. Or you can just literally Google or search in your Spotify, like neurology. You can just pick a podcast. In the toolbox, I listed my favorite neuro podcast, that it's not neuro PT, but it's just a neurology. And I just enjoy listening to it while I'm driving to work, because it's by medical students, and it's just done really well. So they present cases and all of that. And I always say, learn in all ways, meaning auditory, visual, kinesthetic, all that, learning in all ways, always. So you got to incorporate different styles of learning. But I would say start with podcasts, start just to have that, like intro to that. There was one small book in the toolbox that's called the Memorable Neurology, and it's full of mnemonics. in neurology that I love it. That can also be a really good resource for you in school. Haley, hi Haley. She was one of my students this past summer. I love her. I'm an SPT. I'm definitely tired. I know. I feel you. I feel you because I remember how it was. I remember. Thank you, Haley. I hope to see you soon. We haven't seen each other in school. Lots of love for you, and keep on going because you're a good one. Hi, Lily. I'm an SPTA and I'm starting a neuroclinical rotation next week. Ooh, okay, nice. I'm a little nervous, but mostly so excited as this is a new population for me. Yes, I'm finding myself more interested in neuro lately, so I want to absorb as much as I can. And as I can hear to see if this is what area. Okay, so you want to see if this is an area you want to work. Any advice on what's best to learn in those settings or how to prepare? Okay, so remember my Mindy Matters binder? So this is let me see if you can see it. Let me see how my camera looks. Where am I? Where am I? I can't find myself. Oh, is my camera even on? Oh yeah. Okay, I found myself. Okay, so this is the Mindy Matters in Physical Therapy that I created when I was a student. If you're a student in a neuro rotation, or you're going to be going to a neuro rotation, create a binder for yourself. So you can like start by printing some articles that, let's say you see a patient with MCA Pusher syndrome, right? So you can print an article and just put it on your binder and just have that as a resource, right? I also have in this, so this is all like behavioral stuff because I was working with TBI. But here I have like anatomy things that I made a copy from a book that at my CI had. I had some like cognitive problem solving. So I would do like balance with like dual task, and I would tell them like, here's some problem solving questions. So, okay, we're doing like a foam exercise, whatever, tandem stance, I don't know, you will see. And then, okay, I'm going to ask you some questions, right? Why do we wear seat belts? So, I'm doing a dual test. So, I added a cognitive section to my binder. And for cognitive, this is a neuro nugget. Your speech therapists have this book that's called, and I'll type it in. It's called a WALC, WALC. It's on the chat. And those books are like filled with like problem solving, abstract thinking, picking the synonym, antonyms, like sequencing. So if you're dealing with a neuro patient who has aphasia or has like problem solving difficulties or things like that, I would do a balance training or a gait training, and then they're answering questions or doing things like that. So then I have like, again, this is part of the walk, like you're doing dual task, and let's say I'm working with a patient. Okay, now you're in this foam, okay, or you're walking. As you walk, you're going to tell me things that shine and go, and then they're walking and they're dual tasking. So, I created this binder to just kind of be my go-to. This is from when I was a student. I keep it because I feel it's just so cute to look back at it. But I would say start your binder with the resources. I have a free, if you go to the Instagram, there's a free neuro exam checklist, and there's also a free how to create brain changing interventions. And then there's this one, top 5 tools. And then I don't know if it's the spinal cord injury one, it's already out there. I need to check, but there's also a free because I love freebies and I love PDFs, spinal cord injury syndromes. So I would say start building your binder, and you can call it any cheesy name. I was not too happy with the Mindy Matters because I was afraid people are going to call it Mindy instead of Mindy, but it's Mindy. So that's your advice. I hope that helps. Bianca, good luck with your rotation. Elena, what's your opinion about applying to residency right after graduation? You can do it. Do it. I didn't because I didn't know what to do with my life. Okay. Remember that I didn't have a job and I don't know what to do. There's benefits, right? There's benefits because now you know how to document, now you have more patient experience, but residencies won't discriminate whether you're straight out of school or have experience. They don't. So I don't have, I mean, I did it with 1 year under my belt. The only thing that helped me is documentation. I was faster. But with patient care is, you know, you start from scratch kind of because they start mentoring you. Priya, please tell me, Priya, if I'm pronouncing your name correctly. Hi, Lily. Thank you for sharing your story. Of course, I'm an SPT, currently my 3rd rotation at an inpatient. Okay, thank you, Priya. At an inpatient rehab and seeing a lot of neurodiagnosis. How did you build up an intervention toolbox? Ooh, okay. And feel comfortable trying new and innovative things when you really haven't had the practice. Okay. So in neuro, Priya, it's always trial and error. Always. Like, there's numerous times that I'm like, I have an idea. And then it's like, nope, doesn't work. Even, you know, 7 years of experience is like, nope, it's not working. All right, we're gonna, you know, start again. So how do I build a neuro toolbox is, one, with experience, right? You start like, ooh, you know, I remember that time that when I did this, now I'm gonna do it again. 2 is right now in neuro, they're pushing a lot with like the high intensity stuff. So things like circuit training, like, you know, high intensity walking, all of that, it's going to be good. Now in neuro, you have to remember, it's not about how fancy the intervention is. It's going to your basic. These people don't even know how to roll. These people don't even know how to stand. These people don't know how to walk, right? So your intervention toolbox is rolling, standing, and walking. And now that's where you start being like a little more creative, right? We're going to practice sit to stands with eyes closed. We're going to practice sit to stands. And every time you stand up, you're going to tell me something that shines. Okay. Okay, now we're gonna walk. And as you walk, you're gonna turn your head side to side because of the grocery store, you're gonna be turning, right? So going back to the basics, and then once you're doing the basics, you sprinkle a little bit of that challenge. Eyes open, eyes closed, head turns, all of that. Now, if you're familiar, Priya, with all the outcome measures in neuro, so like the Berg balance, the FGA, you can measure those, and whatever your patient is not doing well, that becomes your intervention. Okay, so it's with time, and neuro, it's all about trial and error, and you should not be scared of something that doesn't work, whether a cue that doesn't work or whether intervention doesn't work. You just kind of move on. I do it all the time. So I hope that helps. First year, glad it helped, Priya. First year SPT, thank you for your talk. It was just what I needed. Oh, awesome. Anatomy final. Wow. Congratulations, Adrian. I did not see the QR code. Okay. Can you see still? Can you all see my screen still? The QR code? Do you mean Taylor? Hi, I just saw that you're here. You meant, oh, let me give you the other one for cerebellar ataxia, if that's the one that you're looking. So this is the one, if you want to be one of the first ones to know about this workshop. It's already being, I'm already creating it. It's going to be good because we're going to address multi things. So sensory, proprioception, cognitive, optimal, all of those things we're going to be addressing. And I'm going to give you very interesting things about this little brain part. Can you give some advice on how to develop the skill to read between the lines? I think you mean, Adrian, like you start to recognizing things. Is that what you mean? Like when patients are telling you things, like I feel this when I do that, or like I'm experiencing this when, is that what you mean, Adrian? Like you
Yeah,
mean like differential diagnosis?
yeah, I'm referring
Yeah.
to what you touched on when you want to be present with patient and actually listen to them and
Mm-hmm.
see like how they're speaking or how they're behaving and getting sort of
Yeah.
hints of what's going on from that.
Yes. So one of the things that I said is with your patients, you need to be present and you attend active listening, right? We've all heard active listening, but this is a skill that you develop because it's sitting there and my full attention is on you, right? So that's one thing, right? You need to develop that skill of my full attention is on you and I am not thinking about what I'm going to have for lunch or, being in telehealth when I learned this, I could not like type or, be on my phone or, looking around. Like it was like you're on my screen talking to me, you're looking at me, my face, right? So that's one thing. The other thing with differential diagnosis, meaning reading between the lines when patients are telling you, this is what I feel, this is what I don't feel. The best way to develop that is learning your different diagnoses fairly well. So this is how Parkinson's present and this is how they start. This is how stroke starts. This is how MS starts. And then let's say when your patient starts coming to you and they're like, I got referred but I have like pins and needles, then you always want to ask secondary questions. Okay, now tell me more about that. Okay, well, and then you start digging, right? But with that, Adrian, comes the other skill of kind of bringing your patient if they go like, oh, 3 years ago, 10 years ago, you're like, no, let's come back to so you got to learn both things. You got to learn how to dig deep. You also got to learn how to limit the patient, because sometimes patients, since nobody's listening, right, doctors don't spend a lot of time with them, they want to tell you everything. So but you gotta just make sure to start asking the right questions. Maybe it could be yes or no questions. Maybe it can be, tell me specifically about this symptom that you're talking about. I want to know, when does it get worse? When did this start? Did this start recently? So creating questions that are specific, but allowing the patient to express themselves, but also to not go on tangents, because when once they are on a tangent, it's really hard to, bring them back. But it's just learning the diagnoses a lot. It's just how you start developing that skill to read between the lines, because you then start identifying patterns, right? This is how Parkinson's present with less, or this is how an encephalopathy presents as, or this is how Guillain-Barré starts. So you just gotta know the diagnosis. And the best way that I learned this is through podcasts, the neurology podcasts, because they present clinical vignettes. So it's back in the toolbox. If anybody accesses the toolbox, please let me know if it was successful, because again, my tech skills are not as great. But I hope that helped you, Adrian.
Yes, it did. Thank you.
Awesome. Well, it's 7:10 and I want to be respectful of your time, because I know everyone has things to do and some of you are students and need to get back to your studying, or someone might be so tired from your rotation or work or whatever. But please reach out with more questions to the Brain PT. It's on Instagram, the_brain_PT. University of Texas. Is this San Antonio? Austin? Yes, okay. Hello. Please reach out. Please, I love love when people reach out through Instagram. And remember that now the videos are migrating to YouTube because Instagram, I hate this like algorithm thing. So they're not going to be on YouTube and they're more organized. So you'll be able to access. So thank you so much for being here and giving me a piece of your day. I really hope that you follow that little voice inside of you that is telling you you're meant to do great things.